Good morning, everyone. My name is Shelley Kundick. I am a nursing clinical educator with Archer Review, and I am so excited to be here with you today for Rapid 30. Rapid 30 basically means we are going to spend the next 30 minutes doing as many NGN style questions as we can, just to give you a little practice and a little review, and to practice some testing strategies together as well. And so I just want to make sure everyone can see me and hear me. Just give me a quick little comment in the chat or in the comments if you're able to see and hear me and everything is working well. Perfect. Wonderful. Lots of you here today. So excited to see all of you. Thank you. Good morning and hello to all of you as well. All right, well, let's just jump right into it. I'm going to try to keep an eye on our social media comments as well as Zoom comments, and so I'll do my best to follow up with any questions that you have. But there are a lot more of you than there are of me, and so I will do my best to keep you on top of things. But let's just jump in to our question number one. The emergency department nurse is caring for a client with a hypertensive emergency. The nurse should obtain a prescription for intravenous what? All right, so we always want to pick out those key words. We have a client with a hypertensive emergency. Which of these medications, IV, are we going to want to see this client receive? Look that over, give me your answer choice in the chat, and then we'll discuss it together. All right, I'm seeing some good answers. Um, Looks like the majority of you are going with answer choice C, which is absolutely correct. Nicardipine. Let's talk about why we pick nicardipine. Nicardipine is a calcium channel blocker. It's given IV and it helps lower blood pressure during a hypertensive emergency. This is exactly what we're looking for based on the keywords in this question. Let's take a minute to just review the other meds here and make sure we understand why we didn't choose them. Dobutamine, that can help increase cardiac output. It increases myocardial contractility, but it doesn't do enough for a hypertensive crisis. So it's not going to be our best option. Digoxin doesn't vasodilate. It's not going to be super helpful in a hypertensive emergency either. And then amiodarine is an antiarrhythmic. So we're going to see it used in VFib, AFib, those types of situations, but not in a hypertensive emergency. So if you picked C, congratulations, you got the right answer. All right, on to question number two. The nurse is reviewing Hirschsprung's disease with a group of nursing students. It would be appropriate for the nurse to identify the primary treatment as what? So we're looking at Hirschsprung's disease. What is the primary treatment for Hirschsprung's disease? We've got a whole variety of answers coming through on this one, seeing a little bit of everything on this. Um, let's go ahead and discuss this one. Hirschsprung's disease is something we see in our newborn clients when they are born without nerve endings in part of their colon. And the primary treatment for Hirschsprung's disease is going to be surgical repair. The surgical repair may vary slightly based on exactly what part of the colon is missing those nerve endings, how widespread that is, but surgical repair, possibly a colectomy, is what we will see for the treatment for Hirschsprung's disease. So those of you that picked 8, great job. Those of you that didn't, that's okay. We're still learning, we're still growing. Just remember, surgical repair is how we typically treat Hirschsprung's disease. All right, on to our next question. The nurse is caring for a client with a basilar skull fracture. Which assessment finding requires immediate follow-up? So we have a client with a basilar skull fracture. Immediate follow-up. That means which one of these items would we be like, this is an emergency. I need to get in there and figure out what's going on right away. Tell me what would draw your immediate attention for this client. All right, this one looks like it's just a little bit tricky. We are getting a variety of answers, but I'm honestly not seeing a lot of the correct answer on this one. So this will be a good one for us to talk about just a little bit. So with the basilar skull fracture, out of these four items, the one that we would be most concerned about would be the temperature of 100.9. Now, any ideas why that temperature would be concerning? Anyone that picked C have any suggestions on why? Infection, there's a specific infection that this client is at risk for with that basilar skull fracture. Yes, Harita, absolutely. We are concerned about meningitis. There is, with that basilar skull fracture, there's direct communication of cerebrospinal fluid with the ear or nasal passages. And that infecting organism that's created by that skull damage from that basilar skull fracture can enter the CNS and it can lead to meningitis. So, fever would be taken very seriously in this client because that would be one of the first symptoms indicating that possibly this client was developing meningitis. These other items on here are a little more expected, a little bit less concerning. So remember, in this type of a question, we are looking for something unexpected, something that is not typically seen in that condition, and something that could lead to loss of life for the client if it was ignored. And in this situation, it would be temperature due to the fact that they could be developing meningitis. All right, we are going to take a little pause right now from answering questions and talk about one of our Archer Review products. Intense Prep is our number one recommended package for repeat test takers. How many of you are familiar with Intense Prep? Tell me in the chat. Is Intense Prep something that some of you may be Intense Prep students right now? Some of you may have heard of it. Maybe some of you just want a little more information. Several of you say you've never heard of it. How many of you are repeat test takers? Let me ask that question real quick as well. Several of you might, I see I am, a couple of I ams showing up, me. Yes. So this is our number one recommended package for repeat test takers. It is a specifically crafted program that is meant to really give you a thorough review of everything you need to know for the NCLEX. Let me kind of walk you through exactly what Intense Prep includes. It has a structured schedule. We offer a 6-week and a 10-week schedule that is very structured. You get a study calendar. It tells you exactly what to be doing every day during those 6 to 10 weeks. It requires a lot of time and a lot of commitment. You're expected to study 6 days a week. If you're doing the 6-week program, about 4 to 6 hours a day of study time. The 10-week program spreads that out just a little bit so you could spend maybe 3 to 4 hours of study time per day. In that structured schedule, we focus a lot on testing strategies and we focus on content review. You get to attend live lectures every Monday, Wednesday, and Friday. You have access to the video library. You also have lots of learning activities to help supplement your learning. We provide worksheets, case studies, skeleton notes, flashcards, cheat sheets, everything you need to help pull those concepts together and help you review and help you move forward with your preparations. Of course, you have access to the Q Bank as an RN student. That's over 3,100 questions. As a PN student, it's about half that, but still a great number of questions to be able to follow through with. RNs, or both RN and PN students have a baseline assessment to start with, unlimited readiness assessments and CAT exams as long as you have unused questions in your Q Bank. RN students also have the exit exam as part of their purchase in Intense Prep. In addition, Intense Prep students get to attend the 3-day live. They get a free webinar, which typically most students pick the pharmacology crash course. And this last one, number 6, is the prime thing that students love most about Intense Prep is you are assigned to a cohort with a tutor, with one of our nursing clinical educators, and they are there for you. They are there to answer your emails. They are there to guide you through the process, and they send you feedback videos. Over the course of the program, you get 5 feedback videos from your tutor where they look at your Q Bank, they look at your scores, they look at your strengths and your weaknesses, and they give you recommendations on how to get your scores up, what topics you need to study, how to study them, what to do to get your scores to the point that you are ready to pass your NCLEX. And so this is a tutor guided program with that tutor support that really helps our repeat test takers prepare to pass the NCLEX. It's also great for students who may have graduated a couple of years ago. I've had students in Intense Prep who graduated 15, 20 years ago and are coming back trying to pass that NCLEX, and Intense Prep gave them the guided support that they needed to get themselves NCLEX ready. And so it is a fantastic program that can really give you that guided support and that accountability and that tutor guidance to get yourself ready to go. Yeah, if you are interested in upgrading your plan, I would recommend reaching out to our support email, and they can help you with that. If you have questions about Intense Prep, feel free to reach out to our nursing email, and we will answer those questions and help you understand. Yes, it includes on demand. I'm just trying to look at the questions that have shown up. It does include the on demand, it includes our video library, it includes our live lectures. Intense Prep pretty much includes everything, and it includes that tutor support with the feedback videos. And there's something amazing about having a tutor tell you through a video that you can watch over and over again what your scores look like, what you need to do to improve, where you're performing well. It really helps build your confidence. If you're struggling with confidence, it helps you know when you're ready to test. It helps you know if you're not quite there and how to get there. So what's the difference between Intense Prep and on demand? We have on demand videos. We don't have a program that's called on demand. You might be thinking Short Pass. Short Pass is our other biggest package that people purchase. Short Pass includes some of the things that we talked about. It includes the on-demand videos. It includes the live lectures. It includes the Q Bank. It includes the 3-day live. SurePass does not include feedback, and it does not include that tutor support. SurePass does not include the pharmacology crash course or the exit exam either. So those are a couple of things that are very unique to Intense Prep. It really is our all-inclusive package. And so it works great. Like I said, repeat test takers, people who've been out of school for a while, or just someone who's just not quite sure and needs a little guidance getting themselves ready for that first time to test. Which package will be better will definitely depend on the person, depends on your level of commitment. Like I said, Intense Prep is meant to hit hard for those 6 to 10 weeks, depending which study plan you sign up for. And it takes the commitment, where if you're in SurePass, it's a little more self-regulated, and you can spread that out over a longer period of time if that is your goal. Yes, the rapid combo absolutely is sufficient to pass the exam. It really just depends how you learn best. Do you like that accountability? Do you like that tutor support? Do you like someone looking over your scores and helping you know where you are? Or are you someone who functions really well independently? And those are kind of the questions to ask yourself and to kind of think about what package might work best for you. Um, a couple of things to just kind of keep in mind is everybody's on a different journey. Everybody's heading in a different path, and so your preference might look a little different from someone else's. But you can absolutely reach out to us at nursing@archerreview.com if you have more questions about intense prep, and we are happy to help you understand those. If you scan the QR code here on the screen, it will take you to our website where it explains the details of intense prep, kind of walks you through what the program looks like, what it costs, what it includes, how to sign up. Everything will be there if you scan the QR code on the screen, or just look up under archerreview.com and look at our packages for either PN or RN and NCLEX products. Um, Let me see if I've got any other questions. If you have intense prep, the exit exam and the 3-day live is included in that purchase. If you don't have intense prep, if you just have rapid review, you would need to purchase those separately. Let me see if there's any other questions that I missed before we jump back into our rapid review. Um, I think I've got everybody on there. If you are a repeat test taker and you prepared with Archer previously and didn't pass, then you can get a discount code if you go into your Archer account and you put in your pass that you didn't pass and upload your CPR, then they will give you a discount code, a one-time use code if it's the first time that you're asking for it for either intense prep for sure pass to extend your account depending what direction you want to go with it. So there is that option if you have recently not passed. And like I said, reach out to our nursing email, nursing@archerreview.com, and we will absolutely answer any other questions you have about intense prep. It's a fantastic program. I've seen it get a lot of students to passing who were struggling before. I always tell students if you want to get different results, you've got to do something different. And so if you are a repeat test taker, you can't study the exact same way that you studied before and expect the results to be different. You need to look at what you did before, come up with a different plan, and try a different route. And for a lot of students, intense prep works great. If you want that tutor guidance, you want that feedback, you want that all-inclusive package that really covers everything you need. Um, and so, yeah, Cornelius, reach out to our nursing email. Let us know what that concern is, and we can absolutely help you there. We want to make sure everything works out. And so I can't address individual problems through this webinar, but if you reach out to our email, one of our nursing tutors will respond and we'll make sure that everything is taken care of for you. All right. The email is nursing@archerreview.com, and that will be answered by one of our nursing educators. We will get back to you right away and answer any questions that you have. Scanning the QR code here will also give you a lot of details about intense prep as well. All right. And it is with intense prep, you pick either 3-month or 6-month access to all of those resources, and then you get to be in one cohort with a tutor. So you get either the 6-week or the 10-week plan, depending what you sign up for. And you get that time with the tutor, but you get a full 3 months to use your Archer resources. And so it gives you plenty of time to have that time with the tutor, but then to continue preparing, continue progressing, and get yourself completely ready for that NCLEX for a pass. Yes, I will put the email in the Zoom chat. Let me just get that in there real quick for those of you on Zoom. It is nursing@archerreview.com. That is our nursing email, and we will be happy to answer any of those questions that you have about Intense Prep or about any of our other products. All right, perfect. Thank you everyone for listening to a little bit about Intense Prep. We just like to introduce some of our programs to you in these live webinars to make sure you know all of the options that you have available to you through Archer Review. And so let's move on with our rapid review, a rapid 30 questions. Sorry. The nurse is caring for assigned clients. The nurse should initially follow up on the client who, so pretty typical prioritization question here. It's giving you 4 clients. It's asking you who you should see first. So think of your prioritization tools. Think about who would be your top priority. I always like to look at this type of a question and ask myself who would be the most likely to die. If I ignored all 4 of these clients, who would be the most likely to die? And so that's a horrible way to look at it, but a great way to help you pick the client who should take your priority. So look that over. Tell me in the chat, who is your priority client? All right, we're getting lots of different answers again, lots of different opinions on this. So let's walk through this. Another good way to think about this type of a question is who's having expected versus unexpected findings. And so let's walk through each client and decide if they're having expected or unexpected. That's going to give us an initial idea. And then let's think about who has the most life-threatening situation. So A has a basilar skull fracture and has bruises under their eyes. That is very expected. That is something we often see in a client with a basilar skull fracture. So we are not concerned about that. B had a craniotomy and has a change in the Glasgow Coma Scale from 13 to 11 in the last hour. Anytime we see that GCS dropping, that is concerning. We don't want to see that dropping. That shows a worsening in their neurological functioning. And so I'm keeping that answer on the table. I like that one, but I want to see if there's a better answer. Has ALS and is requesting to have resuscitation efforts withheld. ALS has a pretty poor prognosis, and the fact that they're requesting those resuscitation efforts withheld, that's not a priority situation. Has Guillain-Barré syndrome and is reporting lower extremity muscle weakness. Once again, very expected. With Guillain-Barré syndrome, that is what we see. We see lower extremity muscle weakness as an expected finding. So B is my only client who is likely taking a turn for the worse, who is likely having unexpected findings that I am concerned about. I would want to do a rapid neurological assessment. I would want to notify that primary healthcare provider regarding that change in condition. So great job, any of you that picked answer B. All right, let's move on to our next question. The nurse is caring for a client in the emergency department who sustained a high voltage major electrical burn. All right, we're dealing with an electrical burn. Which lab data should the nurse monitor to determine if the client is experiencing a complication from this injury? So we needed to pick one lab out of these 4 that we would want to be keeping an eye on for an electrical burn client. Look those over. Tell me which lab you would be watching. Ooh, seeing a lot of agreement on this question. That's exciting to see. It looks like the majority of you are picking answer choice A, the creatine phosphokinase. which is the correct answer. So great job if you went with A. Tell me why. Why would you be watching A? What are you concerned about developing in this client? Those CK levels would indicate muscle damage, absolutely, as that muscle breakdown that could happen because of that electrical burn going through their body can cause that CK to rise. What would that indicate? There's a condition that would be indicated with that rise in CK due to muscle breakdown. I'm looking to see if anybody, it is rhabdomyolysis. Yes, Luke and Harriet, great job. You guys got it just before I said it. Rhabdomyolysis is a condition that is caused by that rise in CK. Muscle breakdown causes the CK to go up. That CK causes kidney damage. That is why that is so concerning. It can actually put the client into kidney failure. And so if we see that CK start to go up, that is the lab finding that would indicate the most life-threatening condition for the client. We don't want them in kidney failure. So we're going to keep an eye on that right away, from the beginning. And if it starts to go up, we're going to take that very seriously. Um, some of the other labs you would keep an eye on with an electrical burn client, you'd want to keep an eye on their serum potassium, the BUN, the calcium, the CK, like we mentioned, troponin. Those are all things that we would be watching closely in a client with an electrical burn. These other ones really wouldn't be as concerning and would not be as life-threatening. All righty, let's move on. We've got time for a couple more questions. So let's see if we can get through maybe two more questions in our last 5 minutes. The nurse is caring for a client who is having a liver biopsy. Which positioning should the nurse place the client in immediately following the procedure? All right, we're the client has having a liver biopsy. How do we position them post procedure? All right, we've got a few different opinions on answers on this one. Let's think about what is going on with that liver biopsy. The liver is on the right side, and so that's where that biopsy is taking place. And so the correct answer here is to put them on their right lateral position, on that right side. That is basically going to put pressure on the biopsy site, which is going to reduce the risk of post-biopsy bleeding. So it's basically like putting pressure on the site. We would not want them supine. We wouldn't want them sitting with legs dangling. Left lateral is not going to be helpful, but putting them on that right side lets the liver rest against the lateral abdominal wall and basically puts pressure to help reduce bleeding. Great job, those of you. I saw a lot of B answers, so great job on that. All right, let's look at question number 7. The nurse is performing a continuing education course on newborn care and thermoregulation. Which of the following actions by the nurse will prevent evaporative heat loss in the newborn? That is the key phrase here. Always make sure you know exactly what the question is asking you. And this question wants you to pick an action that will prevent evaporative heat loss. So look those answers over. Give me your answer in the chat. All right. Evaporative heat loss. Like I said, that's what we're looking for specifically is evaporative heat loss. That is when moisture from the body surface is lost to the environment. And so, with that in mind, with that definition, always define your terms in a question. We know that A is going to be the right answer. Drying the newborn skin with a towel after the bath. That is going to help prevent evaporative heat loss. And so A is the correct answer. I saw quite a few of you pick that. This was a little tricky question because all of these things are good ideas. They are nothing is blatantly wrong, but we're looking specifically for evaporative heat loss, and A is the only answer that addresses that specifically. All right, you guys, we made it through a good handful of questions in our Rapid 30. I just want to remind you that Archer Review is here for you across the nursing lifespan. We start with pre-nursing help. We have great nursing school packages if you are struggling with nursing school and feel like you need a little supplement to help you get through individual courses or nursing school as a whole. We have amazing NCLEX PN and RN products. I talked about Intense Prep earlier. We also have SurePass, we have Rapid Review, we have our QBank. Lots of options that fit every budget and every need for NCLEX review, along with small group tutoring sessions and individual tutoring with our amazing nursing clinical educators. And then we also have some fantastic nurse practitioner programs as well. So if you are planning to move on once you get that RN license and become a nurse practitioner and head down that path of further education, we are here for you during that experience as well. So we're here every step of the way on your nursing journey. Thank you, you guys, for joining me today. We hit that exactly at 30 minutes. That is amazing. Thank you for your participation. And I'm excited to see you guys around Archer. Like I said, feel free to reach out to nursing@archerreview.com if you have questions about Intense Prep or any of our other products. And I hope to see you guys in the future. Good luck with your studies.